Welcome, everyone. Um, I am Liz Kennedy, and I am going to be moderating this first session, Parade of Career Pathways in the Healthcare Track of Iowa Ideas. We're so happy that you've joined us today for this first important session for our conference. First off, we'd like to thank our sponsor, ITC Midwest, for helping make Iowa Ideas possible. They've given us a lot of support over the years. Here with my panelists, we're going to be discussing this topic of career pathways into healthcare and what creative solutions there are going on around the state right now. With a shortage of nursing and other healthcare professionals in our state, we definitely need creative solutions to help us as we move forward in healthcare practices throughout our state. So welcoming our panelists today, we have Ann Bozen from Waukee High School. Their APEX program is a program that is concerning this topic, and she is an instructor. Kendra Lindloff, who is the nursing standards rep with DIAL, which is also part of the Board of Nursing of the state of Iowa. And then we have Katie Lyman, who's dean at Kirkwood Community College with the Health Occupations and Healthcare Simulation program at Kirkwood Community College. Welcome, everyone.
Thank you.
Thank you.
All right, well, so we're going to do a round robin introduction. So if you could introduce yourself a little more in depth and provide your perspective on this topic. We'll start with Ann.
Okay. Hi, everybody. My name is Ann Bozen. I teach at Waukee's APEX program. It stands for Aspiring Professional Experience. And we have a human services strand. I teach the class Exploration of Health Sciences and Medicine. And this course has been around for, going on 8 or 9 years. The purpose of this course is to explore healthcare careers through job shadowing, informational interviews, career research. Students also learn interprofessional education, and we get out into the Des Moines metro area community to do all of that. So that's where the perspective where we come from. We also do have a CNA and EMT program as well.
Wow, so students can learn those skills while they're still in high school.
Correct. And
awesome.
Get certified.
And get super, all right. Wonderful. Next, let's talk with you, Kendra. Can you talk a little bit about your perspective?
Sure. My name is Kendra Lindloff. I work at the Iowa Board of Nursing. Is now the Department of Inspection, Appeals, and Licensing. One of my primary roles is to work with workforce data and then collaborating with nursing education partners and community partners to bring them together. I've been doing a bit of a speaker series lately talking about data. We have a wealth of data at the Iowa Board of Nursing to help us get an idea of our licensees and kind of the needs that are out there in the public. I also serve on a lot of committees as well to help kind of give information for those folks that are working on legislation around the topics as well. So thank you for letting me be here.
Yes. Next, Katie.
Hi, everyone. I'm Dr. Katie Lyman. As Liz indicated, I'm the Dean of Health Occupations and Healthcare Simulation at Kirkwood Community College. I'm just starting my third year, so I'm still learning about Iowa and Kirkwood, and people talk about the weather, but I moved from Fargo, so I think the weather in Iowa is fantastic. In health, we have a variety of healthcare programs at Kirkwood Community College. Specifically, what health occupations entails are both short-term certificates as well as longer-term credit programs. So in health occupations, we have paramedic, which is a 4-semester program, everything from EMT, which can be taken for credit or non-credit, or CNA, med aid, med manager, phlebotomy. So really a wide variety of careers, and certainly excited to be here. And I know one of the questions one of the topics we're going to talk about is some of those professions that we don't often hear about. The medical coding isn't featured on Grey's Anatomy, right? And so just trying to provide talk a few more of those things with my colleagues here, just to talk about how we get more people into healthcare. Maybe that's not always direct patient contact, but how we serve that workforce shortage.
Yeah, so that's a great segue into that topic. I think that's a good place to start. With with the current state, and we'll talk about metrics too, but the current state of the workforce needs that we have in Iowa, which, could be construed either as dire or as like an exciting opportunity, if you look at it from the student perspective. One of the things that comes up is a lack of familiarity with the variety of roles and different creative career pathways that can be part of healthcare, whether it be an IT role that's somewhat connected to healthcare or other fields within healthcare that just don't get the kind of notoriety that doctor or nurse or other types of roles. So maybe talk about that, Katie, and we'll go around the room, get other perspectives.
Sure. So to your point, it's that so many, when you say healthcare, people often think that it has to involve direct patient contact and that it involves sometimes scary things, dealing with like a car accident, or for some people, blood is really scary, right? And so there's so many opportunities. So I want to give a shout out to Anne and what she's doing at her school, which is really to provide high school students with the opportunity to explore and to learn more about. I can honestly say that when I was in high school, even though I ended up going into healthcare, I didn't know what a phlebotomist was. And so how do we do a better job of not only with high school students, but those individuals who might be wanting a career change, right? If you're 45, 50 years old and you say, I don't want to do what I'm currently doing, how can I give back to my community? How could I work in a rural hospital? And what does that look like without having to go to medical school for, 12 or 15 years? And so just really, trying to just get the word out, trying to educate. And I don't know, maybe we need to contact Hollywood and have them do a whole series on phlebotomists and medical coders or something like that, because then all of a sudden everyone would know about those particular career paths.
Yes. And I can add on to that from my area. Juniors and seniors come into my studio in my classroom every year and they want to be a doctor or a nurse. And I feel like it is my job to show them those other career paths. They don't understand that in pharmacy, there's 500 different careers you could have. They don't understand that nurses could work outside of the hospital in insurance. They don't understand all the different people that make a hospital run. So that is one of the things I try and do is open them up to speakers they may not have thought of, or bring people in that they just wouldn't think of those careers. And so that is really a charge of mine, I think, at my level, for sure.
Yeah. So, how do you help those high school students? Like what parts, or maybe is a single course, or is it a variety of courses over time where they get those familiarities with the different career paths?
Well, I try to make it based on their interest areas, but again, they don't know what they don't know. So I bring in speakers. We do tours of local organizations, hospitals, schools in the area that offer different programs that maybe they're not aware of. So I'm opportunity based. I make it so that I can do as much in a semester as I can, and then maybe they can take the CNA class after my class or the EMT class. But it really is to explore what's out there. And I will tell you, since COVID, I've had a lot more openings to be able to do this because of the shortage. People are wanting my students to come see what they have to offer as a workplace. And so therefore, I'm getting a lot more opportunities in the last year or so.
Oh, that's wonderful. So good source of opportunity for collaboration. Kendra, when we talked earlier, you had mentioned the different entrepreneurial sides, but what else could you offer about this type of pathway of getting familiar with these unfamiliar roles?
Sure. In a previous life, I worked at a nursing program as a director, and I think those career days are very important and starting those pretty early. And then any kind of exposure that we can get for folks to understand what does a healthcare career look like. And just because you start in one aspect of it doesn't mean you always end up end up in that aspect for the rest of your life. I know plenty of folks that have started in one particular healthcare career, and maybe down the road, then they decide to do something else. There's a shortage from the whole spectrum. I mean, we need family care providers. So we need doctors, we need pharmacists, we need dentists. So there is a shortage, and there's a shortage throughout the nation. So just things to think about. There's also the governor recently is rolling out that the community colleges are going to have what's called HOSA, which is a health occupations career group that can provide exposure to those younger folks and having like career pathway days, and then we also have future ready scholarship opportunities for students as well. So something for students to think about as they move forward into their career pathways. What kind of funds can they use to help fund their education? So there's plenty of opportunities out there. It's finding the right fit for the right person and then evolving with that as they grow.
Yeah, I know, Dr. Lyman here is representing a community college, but at the Regent level, they also have new funding that's available for students entering those high demand pathways. So there is a ton of opportunity out there. I know my own family, my mom started as a nurse and then eventually worked her way up into risk management by the end of her career. So, I mean, there is a lot of flexibility within a career path in healthcare that may start in one place and move to another.
Right. And there's a lot of innovative business type things that are going on out there to help with some of the shortage things like virtual nursing. I was sat in a meeting one day and they were talking about a virtual nurse coming in to do the admissions in the hospital and then a virtual nurse doing the discharging. So are there other opportunities that people just really don't think about?
Yeah. So with those virtual things and telemedicine in general that we kind of got more exposure to over the pandemic, is that helping us alleviate some of our shortages in our rural areas in Iowa, or is it still a lot to be done there?
I don't have any hard facts data, but I know it does help kind of bridge a gap for folks where they don't necessarily have, say, an emergency room provider. They may have somebody virtual in, or maybe there's some opportunity for some telehealth to see a professional that has a very specific area that they would need to see for the client. So I think there is opportunity there. I don't have any data for you, but I hope that the technology that we have available, we're utilizing to its capacity to help alleviate some stress for folks.
Uh, so switching gears, let's just talk about that pipeline. Can you share a little bit about the current state of the healthcare education pipeline in Iowa, especially focusing on the transition from high school to post-secondary education and next to the workforce? What's the current state of things and how things are going? And we'll start with you, Dr. Lyman.
I don't have any hard data as far as how many people are persisting and continuing through. I know that there are a lot of opportunities for high school students as my colleague, Ms. Bozen, talked about, students getting a short-term credential, CNA or EMT in high school. As far as addressing the workforce shortage, there is so much funding and so many opportunities and different paths that people can take. And I think if there's something that, and I don't have the magical answer, but it's about getting the word out. There's gap funding. There's apprenticeship models. There's, students taking things for free in high school and graduating with their high school diploma and already having their EMT and can immediately get into the workforce. And so addressing that shortage, I mean, it's not just Iowa, it's not just Eastern Iowa. It is a nationwide component that I know the state of Minnesota is doing free CNA credentials. They don't have to pay for that. But I think we need to think about wraparound services associated with that. And what I mean by that is yes, the education might be free, but an individual can't necessarily stop their full-time job in order to pursue that credential. So what does it look like for childcare, or if respite care is a part of a particular concern for an individual? And so just thinking through the whole situation, and not just like, yes, the training is free, but how do we allow an individual to be successful with the circumstances that they have? So one of the other components that our business and industry partners could really think about is an earn and learn model, whereby an individual is hired through a particular hospital or clinic, and they're actually going to get paid to in addition to the free tuition. So they already have the job. So very similar to an apprenticeship model, but slightly different. And that way, that individual is doing their education and their training, whether that's in a lab or a clinical setting, as a part of the education right in that facility, so that they become familiar with that facility from the very beginning. And so those are just some examples of, again, I don't have the exact data as far as persistence or attrition and those types of things. But what I can tell you is that I think we still have some opportunity to assist those individuals in getting into that, either into the education and receive the credential, or into the actual, they already have the credential and getting that first job.
And I can echo what Dr. Lyman is speaking of. From my perspective, I'm seeing that being offered at local organizations that, as you earn your patient care technician, PCT, at a local hospital, they'll also pay for you to go back to nursing school. They're even lowering the age of part-time workers in the hospital to 16 in some instances, for that exact reason. If we can get them into our organization, they can see what it's like at that age to work in a hospital, and then we can move them up, step them up the ladder, and keep them as our employees, for sure.
That's interesting. I think one of the at the Gazette, I help manage our job board, Quarter Careers, and one of the complaints that we often hear from job seekers is they don't find a lot of employers who are willing to train them on the job. But this is like example of like, well, have you considered healthcare? Because you're probably going to get trained on the job potentially. Of course, you're going to get training at individual places, but there might be opportunities to up your credentials at your next role or next career path. Kendra, did you have any comments around this, since you're kind of the data person here?
Sure. I can tell you, I do have some hard data that we do have on the Iowa Board of Nursing. We have an annual report that comes out every year, which I'm working on, FY23. We did see a decrease in enrollment post-COVID and during that COVID phase. But we are seeing a bit of a rebound in enrollment in nursing programs now, because there's so many opportunities. We just really need to keep the word out that, it is a great career. It's a longevity career. There's multiple ways of being a nurse in the healthcare environment. And then also, can we capture some of those folks that want to change careers, and actually that larger purpose of helping folks within that wellness and illness spectrum? So I think there's an opportunity not only to capture those folks that are in high school and grade school, but we also have an opportunity, is there some diversity that we can bring to the table? When I do the data, it's about 93% Caucasian in the state of Iowa. So are there areas that we could tap into some diversity with some folks? Because we want to reflect our population, and we are, predominantly Caucasian, but I do think we have other folks that could have some representation within our healthcare careers.
Yeah, so kind of in that vein, I think we could discuss a little bit about potential solutions with regards to international internationally trained workforce. You know, if you are coming from another country and you actually have a credential in that country, and then you try to come into the US and use that same skill set, you're often faced with barriers. Can anyone here address some of the barriers to getting that healthcare staff into our workforce system? How are we addressing that?
I think sorry, Kendra, I don't know if I cut you
No,
off.
go ahead. Go
Okay.
ahead.
One of the things, and it's I've talked to some of my colleagues in health occupations specifically about this, is so many of our exams are English only. And when you're already in a high stress situation, such as testing, that not having that ability to even be like, oh, I just need help with like one word to really truly understand this question. And so I don't have the power or the ability to necessarily change that at a state level. But to your point, Liz, is that Iowa isn't only Caucasian, that we have residents and we have patients who are speaking many languages and are coming from many different countries and different cultures and different practices. And so I think we have to do a better job at a state and national regulatory level of recognizing some of those ideas and being able to help them find a path and a career in Iowa that will allow them to still provide patient care. So even if it's not going to be like you were a doctor in a different country and you can't be a doctor here, how can we help them become a CNA? And there are translation services once they get into long-term care facilities, and there's lots of different options. But we have a gatekeeper with those exams that I think there's an opportunity for us to truly look at that and remove that barrier for particular individuals.
Kendra, did you have comments? Yeah.
Yeah, just to piggyback off of that, our exam for nursing is the NCLEX, and it is an international exam. There is an English requirement just because of the emergency care situation. So if you were in an emergency room, there has to be that standard means of communication between the healthcare providers. But there is an opportunity for us to help those folks that are English language learners. Could there be some resources to help them with those languages? And I always talk to students, there's English and then there's medical language as well. So it's almost like a third language if English isn't your primary language. So there's some opportunity. Could we have some resources funneled towards that set of folks to help them with the English so they can work in those types of settings? And then alternatively, is there an opportunity for us to have, I mean, bilingual is such a high value in healthcare because a lot of times you have folks that don't speak English that you're caring for. So I do think that there's some opportunities for us to look at as a state and as a healthcare occupations to help folks get to that means of communication level.
Beyond the language requirements, are there any other barriers that are significant in allowing international workforce to join our workforce here in Iowa?
Do you want me to
Sure,
address
yeah.
this one?
Yeah.
I'm pretty familiar with. The education process isn't standardized throughout the world for especially nursing and physicians as well. I've worked in operating rooms where we have physicians, say from Russia or from another country, who are being an operating room tech or a scrub tech, just because the education process is different. We don't want to have real high barriers for these folks, but we also want to make sure that it's an even playing field as well. I know at the Board of Nursing, we work with folks, we send it through a outside source that evaluates their transcripts. And then we work with the community colleges and with the private four-year schools and the regent schools to help them get the course that they might need. Recently, I had a particular individual from China, and all they really needed was a course in mental health. And then they would be eligible to take that NCLEX exam. So we really work with folks and helping them get those resources so they can decrease those barriers.
Interesting. Well, let's shift our talk a little bit here to some of the technology that is new and emerging in this field. And of course, we have the role of AI now. It's going to be part of every talk at Iowa Ideas, probably in some shape or form. But is AI certain to disrupt certain healthcare roles completely, or could it have a really beneficial effect on relieving some of the workforce pressures we have? And beyond, AI, there's other technologies at work that may be influencing our career pathways. Anyone want to take this question on what the current, how are you how do you foresee how technology is shaping the next stage of workforce development in Iowa and healthcare?
I can add something as well. And this was a while ago. I did a stint at a VA hospital, and they used a robot to deliver medications to the unit, which these hunter-gatherer type functions that folks do in healthcare, there's an opportunity for us to take that piece out so we can really focus on the client and focus on the convalescing on the wellness of the client and helping them heal from whatever process. So are there functions that respiratory therapists, CNAs, nurses do that are not necessarily, I didn't really go to school to go and get towels, right? It's not below my position, but could there be an opportunity for that function to be automatized or some form of technology to help with those types of things? And I think those are, great questions. I know there's things going on out there, but I'm not aware of all of them. But that one example, I thought that was ingenious that they were delivering medications. So a pharmacist or a pharm tech didn't have to be going to every level of the hospital. The robot actually delivered it.
So we just did an AI debate in my course. They used AI chat GPT to help them create their debate and it was a medical healthcare topic. But at the end, I was like, how do you guys see AI, possibly helping in the future? And they had a couple really good ideas. One was exactly what ChatGPT does and gathering information that maybe a provider needs or someone trying to figure out a diagnosis. And then another student was, what about scheduling? What about, automating how things function in a clinic or a hospital? So they're already being introduced to how to use ChatGPT in school, and because we know it's there, right?
Mm-hmm.
And they're going to use it. So maybe they'll be the ones who bring these ideas to the forefront.
Dr. Lyman, you seeing this in the community college level somewhat?
We are. And I think, from a clinician standpoint is that I think there's opportunity for all of it. I just recently had an appointment myself and they're like, check in before your arrival. And so while that's not Chat GPT or necessarily AI, it's technology can make things more efficient and we can capitalize on what technology has given us. So overseeing the healthcare simulation center at Kirkwood is that we have high fidelity mannequins that can have literally any condition that we tell it to have. I often tell our industry partners is that what's stopping us is only our imagination. And so when we are working with, say, an emergency response team with General Mills, is that we take the mannequin out and we pretend that the skid steer ran over the mannequin, right? And so what does that look like? So I think that technology, when used ethically and morally and all of those things, can really truly be a benefit. I think our students are much more prepared because it's not the first time that they've had a quote unquote patient have a heart attack. Right? Is that they've dealt with it in a sterile, safe environment with these high fidelity mannequins that I didn't have access to when I was going through. And so we can provide CNA training through like the headset of like you're pretending to push a patient in a bed and some of those types of things. So it could provide rural individuals with access to the education that we need them to have. So, just because there's a healthcare simulation center in Cedar Rapids, Iowa, that isn't necessarily helping, say, Fruitland, Iowa, where it's going to be an hour and a half drive for them to experience some of those particular scenarios. So I think AI really does have a role, and I think we're just on the precipice here of seeing where it's going to help and lead us.
And to piggyback on that, technology, if we could get more technology, even at this age, at the 11th and 12th grade, I have a mannequin. It was donated. It's high fidelity. And the students are enthralled with learning about it and how to set up those scenarios. What can we do at this level and even younger to get students interested in healthcare? And I do run a HOSA club too, Linda. It's required now if you have a health science program in a secondary school that you have a HOSA organization, and that is a student organization that is focused on future professionals in healthcare. The more technology we can get in their hands, the more prepared they're going to be, the more excited they're going to be for these healthcare career paths.
Oh, that's exciting. Talking through, so one of the areas that we need to grow, especially, is the CNA pathway. And so for the high school with the CNA pathway, how successful has the program been in terms of student engagement, completion, and transition to the workforce? Are there a lot of students like who were maybe not that interested and then get exposure and then are like, oh yeah, this is really exciting? From your perspective, Anne, what are you seeing on the ground?
Yeah, so we're in our third year. We had to reinstate our CNA program after some things happened. There's great interest. We have wait lists to get on there, but the ratio of, the teacher to the students has to be a certain ratio. We've actually hired another part-time instructor because of the interest. They're excited. I can't speak to how it's looking post-secondary because I'm an instructor as far as them getting jobs, but I know of many students that I've heard of that have gone on to get PCT jobs in local hospitals, for sure, in the emergency room, downtown on med-surg floors. They are using those skills, but I can't speak to how many. But we are getting approached by everyone in the area because we have a CNA program. And I think any school that has a CNA program is also getting approached. Can we reach out to your students? We have job opportunities for your students. So they need it and they're looking for it. That's for sure.
I think one thing that we need to maybe think about is that a lot of times CNA is the requirement for the nursing program, but are there folks that are really interested in being a CNA for that longevity of a career? And that's okay. Because otherwise we're just kind of pushing it along in the system. And I think there's value. I was a CNA. I did it because I was going to nursing school, but I think we need to really emphasize as well that this could be a lifelong opportunity for you as a career as well. And it can be satisfying as a career. So I think there needs to be some focus on that sometimes as well.
And I am hearing that from the local hospitals. They are asking, and I can see that for some of our students. I can see this being their career. So yes.
Yeah.
And I think that's something we wrestle with a little bit. We have a rather robust high school academy program at all most of our regional centers across Kirkwood. I think what's been interesting is that some students have been able to take this opportunity and go into the high school academy. But again, there are some potential barriers for other students not being able to do it while they're in high school. And it could simply be because they're a 3-sport athlete, they're in band, right? It just doesn't work with their schedule. It could also be that maybe they're struggling academically in high school, and so they aren't able to take a college class through Kirkwood because they're doing some high school standards. And so how do we open up CNA to more individuals, including those who might be struggling or just don't have the ability to take part in it in that way. And so rather than there being barriers and us being the gatekeeper, that's great if you're 4-year bound and you want to go to the University of Iowa for your nursing degree, and that's fantastic, and we want to applaud you and support you on your journey. There are, however, a lot of other individuals who would really benefit from being able to capitalize on the short-term certificate that I think we're not reaching at that high school level where they can get it for free. And so how do we really examine and investigate that particular component where we're missing some individuals who really, to Kendra's point, really wanting to be a CNA. But by the time then they graduate high school, now it's not free anymore necessarily. So we have to do a better job of looking at, of looking at where everybody is starting from and being able to help them progress on their own journey.
Yeah, I think that's a valid point. And not every kid in high school is mature enough to be, pursuing a workforce, initiative. I mean, I think it's just, especially with COVID, I think many of our kids are a little bit delayed when it comes to maturity and just, their social abilities as well. And I have found that, I see kids that like, okay, it's going to take them another year. Like if they could have another year of high school, they would have been at the maturity level that some of the other kids who sort of kind of excelled in high school and were able to take on some of those extra, workforce passions. But as far as our statewide strategy, let's kind of turn to that from the perspective, Kendra, of the state boards. What long-term strategies are being considered to ensure this sustainable healthcare workforce? Like you were saying, there's many different ways in, there's many different levels of career path folks want to be at.
I think the key is collaboration. Our community partners and our ed partners, bringing those folks together to find out what our community partners are really needing. We've done demand surveys, and I think that would be another opportunity for us to do demand surveys in certain sections. We need to base it on data. I mean, we can get a sense of what's going on, but I think the data would help drive some of those initiatives. As far as like my vision myself, taking my hat off for a minute, I'd like to see us form a workforce center just for health careers and base it around some data that we have, and then make some, collaborations with those partnerships to help folks. We have some great opportunities. Dr. Lyman was talking about the simulation piece. That's a great way to help folks get educated around different types of healthcare situations and settings. It doesn't always have to be a hospital setting. It could be a community setting. One of our community colleges has an ambulance in one of their simulation centers, and most of them do now, or some opportunity around that. So there could be those emergency medical services pieces. So I would just really like to see some data around some demand and some of the careers, and then base some of our initiatives as we move forward around that data. That's my vision. And my ultimate vision would be fewer vacancies and a healthy workforce. There's a multitude of issues workforce wise, and we see that on the national level. There's an increase of violence in healthcare settings, unfortunately. There's some statistics around healthcare workers and suicide. So how do we not only just get folks in, but keep them and retain them, talk about the issues that are going on in healthcare. There's a lot of great positives going on in healthcare right now. So I don't want you to think it's gloom and doom, but I think that we do have some things that we need to address as a whole.
And
Yeah,
I'd like,
yeah. Are students talking about those issues, Anne?
oh yes, they are, and they're getting a picture of it through my course and the exploration. But I was going to piggyback on, I'd love to see micro certifications at the high school level. What are some more things I can bring in to my classroom? Even I do, BLS, basic life saving, stop the bleed, and then we have our CNA and our EMT. But what other things can we start providing at this age with the maturity levels, right? To offer students so that they can take the next steps to start a career right out of high school or start a career and attend a community college. What else can we do to help, I guess?
Dr. Lyman, do you have any comments on that, or are you seeing anything with community colleges at the statewide level that are exciting?
I would say that from the community college perspective is that there's just so much funding available to help students pursue the path that they want to pursue. It's not it's just not widespread. So I think there's still some work behind how we could increase that funding, especially if they don't want to pursue it from a traditional credit setting, if they wanted to go more from a continuing education standpoint. So for example, individuals who want to upskill from EMT to AEMT is traditionally not a credit course. We offer it in continuing education, and that would really provide rural, well, and urban, but mostly rural, with that ability to have that advanced EMT, so that they can start IVs, give some basic medications, and so just allow that a community to have just an increase in healthcare services provided in the event of an emergency. Unfortunately, because it's not credit, people can't use financial aid. And it's quite typically what they have to do is pay for it immediately, and who necessarily just has $2,000 to drop on this particular on this course. So I think that while there is funding for a lot of individuals, I think we so often end up a little bit blinded by that there's this continuing education component where they could upskill and not have to go through that traditional college path, because for some people that's really scary, is that that they're like, nah, I don't want to meet with an advisor, I don't want to go to orientation, I don't want to do those things, I just want my AEMT credential.
Mm-hmm.
And we need to allow those individuals that ability to be able to upskill and not have the tuition be the barrier. So when funding is given to community colleges, just making sure from a state perspective and a legislative perspective that we consider all the entire demographic of Iowa, and that not everybody wants to pursue. Just because it says community college doesn't necessarily doesn't mean it has to be for credit.
Mm-hmm. Yeah, that's interesting. There are a lot of gaps in our rural communities that need to be filled by creative methods, whether that be with a certified nurse practitioner instead of a physician, or different, maybe it's a physician assistant, or different types of roles that can serve some of those community health needs. That if we can get people around the credentialing that they need, then they could stay in their communities. I don't know. So when we're looking at these, goals, like this would be really wonderful if we could fill these gaps. So let's talk about outcome metrics a little bit. what metrics would we be using to measure the success of our creativity and healthcare pathways? And what kind of pictures do they provide to us? I'll turn to you, Kendra, since that's kind of your area.
Yeah, so we have a metric for nursing. We have this test, it's called NCLEX. And so we do have schools that are measured by that. But we also have an opportunity to look at retention within facilities. Because, you know, we can put people in the pipeline, we can graduate them, but we need to think about, you know, if we want that longevity with somebody and what are they looking for in a career. I know that some folks around the country have gone to some concierge services to help people that work in healthcare. Things like picking up dry cleaning or grocery shopping for them or doing things like that. That all was going on during COVID. And a lot of times that's kind of dropped off. But we still have those demands of needing to work extra shifts and everything with some shortage areas. So could those services be resurrected? You know, oil changes, those kinds of things. It seems rather small, but those are things that folks don't get done if they're working extra shifts, and it becomes a kind of a dissatisfier. So how can we support folks? So I think the metric would be attrition and retention. And then, and I think not just nursing, in all areas of healthcare. And as a facility, I think that would be something you would want to look at as you move forward. So hopefully I answered your question.
Yeah, I mean, it kind of brings up, so that this came up in the opening keynote with Lisa Bluter and Jan Tension, was that work-life balance and how important that is in an Iowa basketball team. But it's very important for healthcare industry because it can either discourage folks from entering the field or cause burnout for existing staff. Because your students are potentially entering this field, and are there particular work-life balance issues that are of concern to them?
That is funny that you mentioned that. They just completed their career research project, and they had to pick 3 careers they thought they were interested in and like compare everything, including work-life balance. And a lot of them are really dialed into that. I don't know if it's the generation. I don't know if they've seen their parents work too much and not have a work-life balance, but they are really dialed into a career where they're willing to work extra hours, or they want that work-life balance of, I want an 8 to 5 clinic job where I don't have to bring anything home with me because I want a family. I have a lot of females in my course. It's almost always 80% female. And so I see that a lot from them. But they are already looking at that as far as our speakers, when they come in, talk about it as well. Because we ask them point blank, like, what's your week look like? How do you have time for family? Like, so they're dialed into that for sure.
Dr. Lyman, are you seeing that at the community college level too? Are they experiencing work-life balance issues even in the college level, or?
Absolutely. I think even particularly in the community college setting, is that so many of our students are working full time. I know our nursing department has really looked into this, is that so many of our students end up being part-time nursing students because they have to work full time. And so it just takes them longer to get through the program because and then it's more opportunity to find a barrier and end up quitting. Right. Mm-hmm. And so they're trying, we're really trying to work through and partnering with our business and industries. So Mercy and Unity Point and those types of things to offer scholarships. So that way the students don't have to work or don't have to work as many hours. So I think the work-life balance is it's something that I think, quite honestly, like, yes, I think it's probably generational, but I think we're seeing everybody across generations talk about it. So one program that we recently launched that was higher in enrollment than I anticipated is a medical coding program. And because so many companies allow people to work from home. So so we have instructors, honestly, who live in Washington and who are teaching for us, right? You would never know that, and lives in Washington and is working for a company in Iowa. And so I think we are seeing people who say, that they want to change career paths, and I don't think we should look at that negatively. I think we need to embrace it, and we need to say, okay, how do we still need nurses. We still need nurses to be providing direct patient care. But are there alternative paths? Those wraparound services that Kendra was talking about, I happen to know many clinics who are doing oil changes. You just drop off the car when you start your shift, and the oil is changed for you, and the car is washed, and some of those services, and they're really important to allow individuals. A nurse can't just take a 20-minute lunch break and go get that oil changed. And so if we just have to look at the spectrum of barriers, and try to reduce them. Every initiative is an important initiative, and one initiative isn't going to solve all of the problems. So I think we just have to keep piecing away at what we can do.
I'm glad you
just-
brought that up. Something that we also need to think about is the folks that train the faculty. So we've seen a decrease in the number of nursing faculty over the years. So that needs to be another career pathway. I mean, it's not only just the entry level piece, it's all the way through the spectrum. We can bring people into the pipeline, but we need folks to teach them as well and to have that expertise. And there's a lot of expertise out there. So how do we get folks excited about teaching folks to help that legacy piece? I taught for 10 years. That I felt like that was my way of giving back to the profession. And so how can we tap into that expertise to help get those future healthcare workers excited about healthcare?
Couldn't agree more with you, Kendra, is that we are limited by the number of classes that we can offer, whether it's credit or non-credit, that we could probably fill more sections. But people, if you are a nurse and you're working 12-hour shifts and you have mandated overtime and things like that, the last thing you can do is then also teach a class for a local community college, right? That they need that time to go get the oil changed, right? And
Right.
so we do struggle with faculty and adjunct instructors and some of those things. So it is a very real it's an opportunity. It's not a problem. It is an opportunity to recruit more individuals, and those individuals who have some knowledge of education, right? Just because you're a nurse doesn't automatically mean that you're an educator. And so how do we provide that as well, of getting people excited to be educators and have that knowledge to supply the education appropriately and professionally?
Yeah, so do you guys have continuing education courses for nurses who are interested in becoming educators? Or like, how do they, let's say if someone's in the healthcare field and they're interested in becoming an instructor, but they're not sure where to start, where would they go?
Yeah, so there's a variety of spectrums. So the CNA instructor piece, a lot of times those folks are required to have some long-term care experience, or if they have taken a course. With nursing programs, you can be a clinical instructor if you have a bachelor's degree. You could teach didactically or in the classroom if you have a master's degree or higher. So getting folks excited about kind of that advanced career level. Also, we have quite a few nurse practitioners in the state. Now, most of them are seeing clients, but there could be an opportunity to have that advanced practice focus within teaching. Sometimes the barrier is the comparable compensation. And that seems to be sometimes the biggest barrier for that.
Well, we're coming up on our time, so let's start to move into our future state for Iowa. So with that in mind, I mean, maybe that's another funding gap that we need to solve for is the training of those, or like increasing the pay for teaching staff. But where do you see the healthcare education and workforce development in our state headed in maybe over the next 5 years? I know it's hard to pull out that crystal ball because it seems like our state is changing so rapidly, but what could you see? We'll start with you, Anne.
I can already say I've been on a review board for learning targets for the 6 through 9 grades. So how do we introduce healthcare careers even at a younger age? How do we have more career fairs that are healthcare centered? I know we're having one at one of our high schools. We have 2 coming up here next week where it's a lunch and learn. We're bringing in healthcare organizations into the lunchroom of one of our high schools and having them set up booths. But I think just bringing that exposure down even younger, just so they can start thinking about what it really means to be a doctor or nurse and not what they see on Grey's Anatomy.
Dr. Lyman, your thoughts on the future of our healthcare workforce?
Well, you're going to end up with me on a soapbox necessarily, just about higher education in general. We have to think about how we're delivering delivering education. And what that looks like from a college perspective. People are truly scared of, and I'm guessing Ms. Bozen probably can speak to this, is people are scared of student loan debt. It's been in the news. This is what we've been talking about for the last 5 years, or especially since COVID. And that's a real fear, is that some of these students, and probably Miss Bozen's class, are watching their parents struggle still making those student loan payments. And so what we need to look at, and similar to what I was talking about earlier, is that, okay, you're an EMT and you want to become an AEMT, and do you have that ability to pay, $2,000-$3,000? You're a nurse and you want to become a medical coder. Do you have the ability to just spend $4,500? And so we need to look at it as a industry and not necessarily even healthcare. I think this is a higher education problem that we need to tackle. We've started some conversations. Some institutions of higher ed are a little further along than others, but quite honestly, we have a societal problem as it relates to advancing and upskilling, so that way people can become nurses. I bet there are a lot of people out there. There are a lot of individuals who that the price and student loan debt is the barrier for them pursuing it. So my crystal ball is that that higher ed has to change a little bit in order for us to meet the workforce demands in healthcare.
Okay, I guess I'm up. I think it's multifaceted. I think there's data that needs to be looked at. I think there's technology that needs to be looked at. I would agree with Dr. Lyman and Dr. I don't know if you're Dr. Bozen, in the collaboration of education and community partnerships. I do think there's an opportunity to look at retention in our workforce. Why do people leave? Why are they leaving? We know the post-pandemic, there was some of that, but could we get folks to stay in healthcare longer? Or is there an opportunity to bring those folks in that are looking for that second career? So not only just the beginning, like grade school and junior high and all of that, is there an opportunity for folks that are, maybe in their mid-20s, early 30s that are looking to get into healthcare? Are there folks that are retired that want to give back as well? So I think there's a whole spectrum. There's a lot of opportunity. My wish would be that we wouldn't have having this conversation again in 5 years. That would be my hope, that it would be solved. But I think it is kind of something we're going to be, with for quite a while and have been for a while. Sometimes these things are cyclical. We've been talking about nursing shortages since 1972. I was too, so I wasn't around for that one. But I think we definitely need to really look at longevity wise, how can we address some things that are underlying that have been cyclical the whole time? So, and I think data is the key to that.
Yeah. Well, this has been
I
a
agree.
wonderful discussion today. Any other questions? We haven't had any questions from our audience yet, but any other thoughts on the pathway? Be sure to put it in the chat. I know that each of our participants are available to contact if you have more questions for them or about their particular programs. We just had a really good discussion today. Thank you for attending, and I'll just remind you for the healthcare track, the next session is going to be Cancer in Iowa at 11:15. So thank you so much for joining us today, Kendra, Ann, and Dr. Lyman. I really appreciate your time, and it's been a wonderful session.
Thank you.
Thank you for the opportunity.
Bye-bye.